The Division of Pediatric Hematology and Oncology at Brookdale University Hospital and Medical Center serves a population characterized by ethnic diversity and barriers to healthcare. The area is marked by a high infant mortality rate and a high incidence of sickle cell disease and trait.
Sickle cell disease is an inherited condition of the red blood cells, and it's a condition that's more common in African Americans, but it does affect Hispanics and people in the Mediterranean region and people in India, Saudi Arabia. So it does affect a lot of communities, but it's predominantly more common in African Americans. It is a disease where the red blood cells, instead of being nice and donut shaped, is sickle shaped. When it is sickle shaped, it tends to block blood vessels. So when a hemoglobin has sickle hemoglobin in it, it tends to not be able to carry oxygen that well. And because these red cells have sickle hemoglobin in them, they cannot traverse through the tiny capillaries. So they block these blood vessels and they cause all the complications of sickle cell that we know of. When babies are born with sickle cell disease, they are more prone to infections. So they get what we call sepsis, which is infection of the blood, and they can get meningitis, which is infection of the brain. They can also get pneumonias, which is infection of the lung. Sickle cell disease also affects the heart because the heart works very hard to pump blood in these patients who are anemic. So all these organs need to be monitored very closely.
1 in 500 African Americans suffers from this disease, and 1 in 12 carries the trait. Still, awareness remains low. Since 2002, the community-based sickle cell project under the auspices of the Brookdale University Hospital and Medical Center SickleCell program has worked to improve health outcomes for patients with sickle cell disease, increase community understanding of the disease, and promote detection, genetic counseling, and education for families with sickle cell trait.
The comprehensive pediatric sickle cell program here at Brookdale has been in existence for many, many years. The community-based sickle cell project was actually a project that started out of the program in 2002. It's a partnership with SUNY Downstate Medical Center, Kings County Hospital Center, Interfaith Medical Center. We have a community-based organization, which is Caribbean Women's Health Association, and also Brownsville Multi-Service Family Health Center. We have these partners because this is one way for us to expand our goal of increasing patient care, increasing patient awareness, increasing professional and public awareness and knowledge about sickle cell disease.
In this area of Brooklyn, we have a tremendous number of immigrants, and they make a major part of this population. It is amazing to find that the number of these families are from immigrant families, and they have no clue that they have sickle cell trait. Often their knowledge of sickle cell disease is limited to those patients or family members or acquaintances that they have seen in their countries who have had a bad outcome with the disease.
A dozen or so years earlier, we had lost a child, but we weren't living in the United States. And of course, in third world countries, they didn't have that advanced knowledge of sickle cell or what sickle cell is.
It requires a lot of effort to educate these families and tell them the implications of sickle cell disease and how, with good comprehensive care, we have made a tremendous impact on the management of the disease. Our program follows up all babies who are born with either sickle cell disease or even trait. And we make sure we call back those families of babies born with trait to make sure we educate them so they are very aware of their status.
We would receive the newborn screening results, and those results are from babies who were born in hospitals, and a blood sample was taken from them immediately after birth, sent to the Department of Health, New York State, to be tested for a number of conditions, including sickle cell trait and sickle cell disease. Those newborn screening results are then sent from New York State Department of Health to the various hospitals. I receive those and I outreach to the clients, inviting them to come in for counseling and education on sickle cell trait. Giving them information to make informed decisions is very important.
When I found out she had sickle cell, it was a shock. I knew I always had the trait, but I didn't know that her father had the trait.
When the family comes in to our center, they are often unaware of the fact that they carry the sickle cell trait, and they're also often unaware of the fact that if both parents carried the sickle cell trait, the baby could have the disease. So it often comes as a shock to these families. So it is our responsibility to make sure that the family understands the implications of having sickle cell disease, understands the genetics of sickle cell disease, and understands how they can best take care of their children. Newborn screening has had a tremendous impact on sickle cell education. It has made a big difference in terms of the number of children who survive.
I think one of the things that this community-based sickle cell project has added to the comprehensive program is the outreach and education aspect. This funding has enabled us to really make an impact in the community. And I say that because we've received so many calls to participate, to do workshops, to do tablings, to do outreach. And it's been phenomenal. Being able to be in the schools, being able to be in the libraries, being able to be at shelters, being able to be at health fairs has really increased a level of understanding that we certainly know wasn't there before. The latest project that we are so excited about is the BMS, as it's called for short, school that is also in partnership with the Board of Education, and we started a sickle cell peer training program with them in November of 2005. We have done 2 8-week sessions, and we've trained 6 peer educators who are now able to go into the clinics providing outreach and education to the patients and personnel of the clinic. We find that it's one way that we can extend the sickle cell awareness piece into the school system. We have several activities each year. We start off with a parents retreat in January. Here we have upwards of 20 to 30 parents coming in for a day of relaxation. In May, we have our career day. And our career day is targeted to or patients anywhere between the ages of 9 to 21. And we have professionals from all walks of life coming in just to give them a sampling of various careers that are out there and options that they have. Children with sickle cell disease many of them have a difficult time in school because of absenteeism and illness, but we try to bridge the gap in this way for them. Another aspect that we've highlighted and working very closely with one of our departments, the prenatal care assistance program, and our high-risk clinic here at Brookdale is to do baby showers. And we have included sickle cell in many of those programs. We also work with one of our baby stores, and we've done workshops in the stores and as well as outreach and education.
One of my dreams with having a comprehensive sickle cell program is to make sure that every parent knows everything that can happen to their children. And I want every parent to be an advocate for their child with the disease, whether it's in school or on the playground or just about anywhere. So when we educate them, it becomes more relevant if they meet another parent who has a child with sickle cell disease. So we have a parent support group.
You couldn't walk.
Parents are stressed, having a child with chronic illness, and we want them to know that we are here to support them in everything they do, not only in their child's wellness, but we also make sure that they know they have avenues to de-stress.
The first Thursday of every month, we meet, and it's like that's our day to just come together and unwind, and everybody, because with everybody, life is so busy and fast paced. He doesn't get a chance all the time to call everyone and talk. And so that first Thursday of the month, it feels like you're in a family. Like no one on the outside can understand what you're doing or what you're going through. So it helped me a lot.
It is a lot about building confidence and about making sure that these children grow up to be adults who have self-advocacy.
I think my wish list for the project would be more staffing to make sure that we cover all the events we possibly could, because there is a need, there's a desire to have us there. We're just a few. So personnel to do more outreach and education would be on that wish list.
My name is Chantal. I'm 10 years old and I like to be a fashion designer.
I want to be a game programmer. I want to be a forensic scientist.
A graphic designer.
And I want to be a policeman to help a lot of citizens of the United States.
Our aim and our dream is to make sure that every child with sickle cell disease grows up into a very knowledgeable adult who knows what sickle cell disease can do, who learns of coping mechanisms by which they can cope with pain, cope with different problems associated with the disease, and really be very educated in terms of what are the complications that can occur, and will actually go out and be proactive as they continue into adulthood and remain very active adults, because that is the only way in which this disease will have visibility and will get the kind of care and respect that it deserves.